Good afternoon. Dr. David Kemp here today to talk about multiple sclerosis, MS. Okay, been around a long time, kind of a scary thing, but what we're seeing that it is primarily autoimmune disorder where your body attacks itself. Now, I've been dealing with autoimmune disorders now for about a decade, and I found that a lot of that is food driven. So you got to look and see what foods you're allergic to and eliminate those first. Okay. Now, the next thing you have to do is once you eliminate the inflammation, it's driving the demyelination, then you have to get fat in your diet, right? That's going to help. Myelin is made of fat, so you got to get more fat in your diet, relatively healthy fat like coconut oil and olive oil and avocado, okay, these healthy fats. Now, we know that in MS, the first nucleus in the brain to demyelinate is the medial longitudinal fasciculus. Now, this is also the first in the human brain to myelinate, so ironically it's the first one to lose fat. Now, this nucleus or fasciculus lives in your mesencephalon, your midbrain. Right? Your midbrain has other nuclei that control eye movement. Right? They also control pupil constriction and vision. So one of the common symptoms of MS is blindness, right? Double vision, where your eyes aren't conjugated, they can't move together, they'll move like this. That's called an internuclear ophthalmoplegia, or an INO. That has to be there for you to be diagnosed with MS. I see it a lot in MS. I see it in people without MS too. Now, the other thing we see is what's called a pupillary afferent defect. Now, you have pupils, right? These pupils react to light, right? Brisk or sluggish, whatever they may be. A pupillary afferent defect. So if this pupil constricts, they're connected to a similar chiasm nerve. So when this one constricts, this one should constrict with it. But if this one constricts and this one dilates, right, that's not normal. And that's what we see in MS. These are afferent defects, which are disturbing. This gives them visual sequelae that aren't comfortable, or one vision is clear and one's blurry, or they see far with one eye and near with one eye. Just gives them a visual consequence that's not comfortable. Okay. Now, the other things we see as the plaquing starts to travel down the cord is they start to lose their ability to move and walk, and they have some of them are in wheelchairs. Now, we have some of those patients, and if they do the exercises properly, we see great results. But many of them are driven by medication, and they're driven by their diet. They don't think they need to deflame their diet because other doctors are telling them they don't. Whereas I know from experience that if you don't fix this at the cellular level, it's going to continue to progress. It's kind of a nasty thing, and we don't like people in wheelchairs, so we want to do our best to get you up. But we got to start with deflaming the diet and then implementing exercises to go around all this plaque that you have laid down, these proteins you've laid down in all these pathways. Okay, now, I hope this helps a little bit. Now, there's a lot more about MS that we need to talk about, but I just want you to understand if you're getting some of these weird eye things or this weird vision, then at least get it addressed, okay? Or maybe deflame the diet and see how you do with that, okay? So, if you want any help, right, consider a functional neurologist. They're going to give you the most help with the pupil and eye dynamics, okay? I hope this helps. Have a great day.